club is to create that sense of community so that community can drive change within the neighborhoods that they are living in. And so that's why I feel at this point in time there's an opportunity to reconnect ourselves after the COVID-19 pandemic, where we had to go into our homes, leave our workspaces, and socially isolate, to reconnect those social bonds, help us address our mental wellness, help us address our social well-being, and ultimately help us address physical well-being at the same time.
I grew up down the street, down Castroville Road. You always hear people saying, you need to get out, you need to get out. And it's like, yeah, okay, we can get out and come back and try to make a difference. And that's kind of where my mindset is. In these times, coming out of a pandemic, I think people were isolated. People stayed at home because that's what they were told to do for their safety and for their health. So when they have health clubs like this, they come together with people that live where they live, that have been through the things that they've been through. And that's just easier for people to come out and be part of a community again. And that's what the health club offers. It's just a space for people to come in, be with others, be with friends, and just have a good time. Really, that's just what the whole club's about.
I have been a part of community organizing for many years. For me, this is like the work that I'm doing. I'm part of neighborhoods just like these. I was raised up in communities just like these. So I've made a home out of these communities. Biggest challenge is building trust. What I do is very basic for building trust. It's making sure that I'm visible as much as possible, showing up as much as possible. So a lot of people, they want to show up to an organization and then just volunteer and then leave. For me, it's not just about volunteering, it's about hanging out, it's about making friends, it's about finding similar stories, finding middle grounds, becoming integrated as a friend.
It was great to see everybody back, When I lived alone, so it was very lonely, I mean, it was very, very lonely. There's a few of us here that we come in at 7:45, and we don't leave till 1 o'clock, and we come every day. We come every day.
I like it here, It's like a family to me because I lost a lot of my family already. I would just stay home and sleep, watch TV, or just clean the house. I'm used to coming here, so I just stopped going. But here, they do some movement and things like that, so that keeps me going.
When one hurts, we all hurt, We all laugh, It's just, it's fun.
This is my San Antonio, and this is my house of neighborly where I come and enjoy myself here. In my family, I have doctors, I have nurses, and sometimes they don't have time to explain things to me. We learn about COVID and vaccines. I have all my vaccines, Here I learn a lot about dementia, about falling down. I learned because I asked.
Traditional health education and public health programs oftentimes are presented as classrooms, as learning, as something that we have to get ourselves through. The goal of a club is to go and have fun, to play games, to act silly, to sing songs, to do sketches and skits that make us feel slightly uncomfortable because there's learning in that discomfort. So part of it is the fun that you can have when you do this. Part of it is the ease of the pressure on you to have to deliver information every single time because we're tapping into the collective knowledge of our neighborhood through the club model. And you can create co-facilitators, co-educators from within your club that can then help you deliver information in a culturally and linguistically appropriate way. And at the end of the day, I still believe wholeheartedly that it makes jobs easier because we're not having to go to 50 separate individuals, but we can go and have 2 clubs that get us 25 people at one time, increasing our reach and allowing those individuals to reach out into their families and into their communities farther to further disseminate our information and engage people in health and wellness. I'm excited about the opportunity to rebuild community, help people reconnect with themselves and their community around them, and ultimately rebuild trust between our communities and our healthcare and social service systems that have been working so hard to promote health equity.
Community health workers make the world go round. Becoming a facilitator for health clubs is like all the on-the-ground training that you can ever ask for.
So working with clubs has been one of the best things I've done in my professional career, and I just think a lot of people would benefit and get the same joy that I have out of it if they were to try it.
This is like one of the best trainings for anybody who wants to get into addressing communities of all kinds.
One of the hardest parts of public health engagement, of health behavior promotion, is bringing people together to learn and to take action with that knowledge. And the model gives us that opportunity, right? Because we all want to be part of something bigger than ourselves.